My name's Dr. William, and I need to tell you something that might surprise you. The patients I worry about most are not the ones who never exercise. They are the ones who walk every single day and still come into my office with knee pain, chronic fatigue, numbness shooting down their legs, and a body that feels like it is getting worse instead of better. And when I sit down with them and ask one question, everything becomes clear. That question is not how far did you walk or how long did you walk? The question is, how exactly did you walk? Because here's what almost no one explains to you in a 1-2 minute office visit. Walking the wrong way does not just cancel the benefits, it actively breaks down your joints, compresses your spine, overloads your heart, and drives inflammation deeper into your tissues with every single step. And in my 15 years of practice, I have watched this pattern play out again and again in patients who were absolutely convinced they were doing everything right. Drop your age in the comments right now. Tell me how old you are and whether you walk regularly. I read every single one. What I am about to walk you through, all 7 of these mistakes, is the conversation your doctor does not have time to have with you. Let us start at the beginning. Before we talk about any of the mistakes, you need to understand why walking after 50 is not just pleasant exercise. It is a medical necessity because after 50, your body goes through 4 specific physiological changes that are predictable, measurable, and impossible to ignore. First, your muscle mass begins to disappear. This process has a medical name, sarcopenia. Think of it like a slow leak in a tire. After 50, you lose roughly 1 to 2% of your total muscle mass every single year over a decade. That is 15 to 20% of your entire muscular system gone. And muscle is not just about lifting things. Muscle stabilizes your joints. It regulates your blood sugar, meaning the amount of glucose circulating in your bloodstream. It holds your posture upright. It catches you when you trip. Lose enough of it, and everything downstream starts to fall apart. Second, your joints stiffen. The cartilage at the end of your bones, think of it like the rubber pad on the bottom of a chair leg, has no blood supply of its own. It gets its nutrition exclusively through movement. When you load a joint and move it, a slippery fluid inside the joint called synovial fluid gets pushed into that cartilage and delivers the nutrients it needs to stay healthy. Without regular movement, cartilage literally starves. It thins, it cracks, it breaks down. That breakdown is what we call osteoarthritis, and while it is common, it is not inevitable. You can absolutely accelerate it with the wrong habits. Third, your metabolism slows. Your basal metabolic rate, which is the number of calories your body burns just to keep itself alive while you sit completely still, drops roughly 2 to 3% every decade after 50. That means the exact same lifestyle that kept your weight stable at 30 will cause you to gain weight at 55, not because you changed anything, because your body changed. Fourth, your circulation becomes less efficient. Your blood vessel walls gradually lose their elasticity the way an old rubber band loses its snap. Your heart pumps with slightly less force, and blood flow to the legs, the feet, and the small vessels throughout your lower body starts to deteriorate. This is exactly why so many people over 50 notice cold feet, nighttime leg cramps, and that heavy, tired aching in the lower legs by the end of the day. Here is the remarkable thing. Walking addresses all 4 of those systems simultaneously. It activates muscle. It triggers cartilage nutrition. It revs up metabolism. It improves circulation. Multiple studies confirm that people who walk regularly have significantly lower rates of cardiovascular disease, type 2 diabetes, osteoporosis, which is the thinning and weakening of bones, and cognitive decline. But, and this is the part nobody tells you, all of that only works when you walk correctly. Walk the wrong way, and you do not simply get a smaller benefit. You create a new problem stacked on top of the old ones. Let us go through every one of those mistakes right now. Mistake number one, you start your walk too fast. This is probably the single most common error I see across every age and fitness level. People step out the front door and immediately go full speed. It seems logical. Why ease in when you could just get moving? But your body is not a car. You cannot turn a key and have every system running at full capacity in an instant. And skipping the transition from rest to movement comes with real consequences. Here is what is actually happening inside your body when you start too fast. Your muscle fibers are cold. Cold muscle is less elastic, the way a rubber band is stiff on a cold morning. Less elastic fibers tear more easily. These are called micro tears, tiny microscopic rips in the tissue that cause no immediate symptoms but accumulate quietly over weeks and months into chronic pain. At the same time, the synovial fluid inside your joints has pooled and settled during rest. It needs several minutes of slow, gentle movement to spread evenly across the joint surface and form a protective film between the cartilage layers. Start fast, and your cartilage is essentially running dry, and your cardiovascular system has not warmed up either. When intensity jumps too fast, blood pressure spikes more sharply than it needs to. After 50, when your vessels are already less elastic, that sudden spike puts unnecessary stress on those vessel walls. The fix costs you nothing. Spend the first 3 to 5 minutes of every single walk moving slowly, deliberately slowly, almost leisurely slowly. That is your warm up. It is not just for athletes, it is for every person who wants to walk without pain. After 5 minutes, your joints are lubricated, your muscles are warm, your heart has settled into a working rhythm. Now you can pick up the pace. Mistake number two, your posture is wrong while you walk. Go outside and observe people walking. Most of them are hunched forward, head jutting out ahead of their body, shoulders rolled down and forward, eyes aimed at the pavement a few feet ahead. This is not just unflattering, it is a biomechanical disaster for your spine and your lungs. Here is the mechanics of it. An adult human head weighs about 11 pounds. When it sits directly over the spine in its natural neutral position, your neck muscles carry exactly that load. But when the head drifts forward by just 1 to 1.5 inches, the load on the neck and upper back muscles triples. At 2 inches of forward shift, the load multiplies 4 to 5 times. So instead of carrying 11 pounds, those muscles are now holding 45 to 55 pounds continuously for every minute of your walk. Come home with a neck ache after walking, that is not a draft. That is not old age. That is posture. The second hit lands on your lungs. When your chest is compressed and your shoulders are rolled inward, your diaphragm, which is the dome-shaped breathing muscle that sits below your lungs, cannot fully descend. Think of it like trying to inflate a balloon inside a tightly clenched fist. Your lungs cannot fully expand. You breathe shallow, pulling air only into the top portion of your chest. Your body receives less oxygen than it should. Less oxygen means less energy for your muscles and your brain. You walk for 30 minutes and feel like you walked for an hour. People blame that on age. The real culprit is posture. And there is a third consequence almost nobody mentions. Poor walking posture disrupts the entire chain downward. Head forward, the lower back compensates with an exaggerated arch, the pelvis tilts, and the knees begin operating at the wrong angle. The load on your knee and hip joints increases not because of your age, but because of one specific correctable mechanical error. The fix is simple. Picture a thin thread attached to the very top of your head, pulling you gently upward, not straining, not forcing yourself into a stiff military stance, just allowing your spine to decompress and lengthen naturally, shoulders relaxed, drawn slightly back, eyes forward on the horizon, not down at the ground, chin parallel to the floor, chest open. In this one position, your lungs work at full capacity, your neck carries no excess load, and your spine distributes weight exactly the way it was designed to. Let me tell you about someone I will call Margaret, 6'8", from Phoenix. She came to me with persistent neck pain and what she described as exhaustion after her morning walks. She walked 40 minutes every day without fail. She was doing everything right on paper. When I watched a short video she had taken of herself walking, the problem was immediately obvious. Her head was at least 2 inches in front of her shoulders, her eyes aimed at the ground, her chest completely collapsed. We made one single change. We corrected her posture, no new medications, no referrals. 2 weeks later, the neck pain was gone, and she described her walks as feeling effortless for the first time in years. That is what one correctable mistake costs. Mistake number three, you are wearing the wrong shoes. This is the topic people pay the least attention to when they decide to start walking. They think about the route, the distance, the time of day. Shoes are an afterthought, and that is a serious error because for your joints, there is nothing between you and the ground except your footwear. Two things happen with age that make proper footwear critically important. First, the natural fat pads on the soles of your feet gradually thin out. Those pads existed as built-in shock absorbers. They soften the impact of your heel striking the ground with every step. When that natural cushioning diminishes, your shoes must compensate. If they do not, every single ground impact travels straight up the chain: ankle, knee, hip, lower back. Second, the muscles and ligaments of the foot weaken with age, and the arch of the foot can begin to collapse. This is called acquired flat foot. When the arch collapses, the entire load angle on your knee shifts. The axis of your hip joint changes. Spinal stress increases. Proper arch support in your shoe can meaningfully slow that entire process. What you need in a walking shoe is three things: adequate cushioning in both the heel and the forefoot, firm enough to support but soft enough to absorb impact. Arch support that follows the natural shape of your foot and prevents that inward collapse, and a flexible sole in the front portion of the shoe because your foot needs to bend naturally at the ball with every step. A rigid sole disrupts the heel to toe rolling motion and overloads the calf muscles and the Achilles tendon, the large cord at the back of your ankle. One more critical point about shoes. The outside of your shoe can look perfectly fine long after the cushioning inside is worn out. The midsole, the layer of foam between the outer rubber and the inner lining, loses its shock absorbing ability before any visible wear appears on the surface. If you walk regularly, replace your walking shoes approximately once a year. That single habit is one of the simplest and highest return investments you can make in your joint health. Mistake number four, you walk rarely, but long distances when you do. This is a pattern I see constantly. People are busy during the week, so they take one long walk on Saturday, an hour, sometimes more. They come home tired, feel virtuous, and consider the week handled. From a physiological standpoint, this is fundamentally backwards. Your body does not respond to isolated bursts of activity. It responds to repeated, consistent signals. Every time you walk, your body receives a message. Movement is the norm here. In response to that repeated message, your heart gradually becomes more efficient, your blood vessels adapt, your muscles strengthen, your metabolism stays elevated. This is called training adaptation, and it only occurs when the signal repeats regularly. One walk a week is too weak a signal. The body never adapts. The benefit stays minimal, and worse, a single long walk after several days of complete rest is a stress event for unprepared muscles. They are cold, unadapted, and the next morning they ache. People draw the wrong conclusion from that. Walking is not for me. My joints cannot handle it. The joints are usually fine. The loading pattern is the problem. The science is clear on this. 20 to 30 minutes of walking on most days of the week is the minimum effective dose for your cardiovascular system. That is the pattern that reduces your risk of heart attack, stroke, and type 2 diabetes. Not one long Sunday walk, 5 to 6 shorter walks per week. If you currently walk once a week, start with 3 times, not necessarily 20 minutes. Start with 10. After 2 weeks, add 5 minutes. Gradual progression here is not weakness, it is the correct strategy. Your body adapts to what repeats, only to what repeats. Now, before I give you the last 3 mistakes, and the final one is the one most people never even think about, I want to take a moment. We have already covered 4 things in this video that your last appointment almost certainly never touched. You now understand why your body changes after 50 and what walking actually does inside those 4 systems. You know why starting too fast is damaging your joints from the very first step. You understand what bad posture is doing to your neck, your lungs, and your knees simultaneously. You know that your shoes may be silently loading your joints with every step you take. And you understand why the once a week long walk is not protecting your heart the way you think it is. Everything I wish I had time to explain in the office is in one place, the complete Senior Health Vault. It is a set of 3 plain English guides I put together covering the medications worth questioning, the foods that act as medicine in the body after 60, and a full manual of how the body changes after 70 and what to do about each change. The link is in the description, and you can scan the code on your screen right now. No medical jargon, no overwhelm, just the information organized so you can actually use it. But first, finish this video, because mistake number 6 is the one that is quietly raising your fall risk right now, and most people have no idea. Mistake number 5, your arms are motionless while you walk. Most people either hold their arms stiff at their sides, let them dangle, or shove them in their pockets. It feels comfortable. In reality, it strips away a significant portion of the physiological benefit of walking and disrupts the mechanics of every single stride. Walking is not just leg work. It is a whole body cross pattern movement. When your left leg steps forward, your right arm naturally swings forward in response, and vice versa. This pattern is called cross coordination, and it is hardwired into your nervous system. It distributes the load across your spine symmetrically and reduces the twisting force on your lower back with every step. When your arms do not move, your spine must compensate for that asymmetry. For people who already have lower back issues, this compensation is often the trigger for pain. There's a second reason arm swing matters. Moving your arms recruits the muscles of the shoulders, chest, and upper back. That means significantly more total muscle mass is active during a walk with proper arm movement than during a walk with static arms. More active muscle means higher caloric expenditure, better circulation, and a stronger metabolic response. The exact same distance walked with proper arm swing delivers a meaningfully stronger physiological effect. And a third reason, especially important after 50, arm swing sets rhythm, and rhythm improves coordination. As coordination gradually declines with age, a steady rhythmic arm movement helps maintain a consistent stride and reduces the risk of losing balance mid-step. How to do it correctly? Bend your elbows slightly, roughly a 90-degree angle. Allow them to swing forward and back in a natural rhythm, opposite to your leg movement. You do not need the exaggerated pumping style of a race walker. Just take your arms out of your pockets and let them move. After a few walks, you will feel the difference almost immediately. Walking becomes easier and more rhythmic, and your lower back will thank you. Mistake number 6. You are walking with your phone in your hand. This mistake did not exist 20 years ago. Today, it is one of the most widespread things I see. People walk and look at a screen, reading messages, scrolling through a feed, and they genuinely believe they are taking care of their health. They are not. Start with posture. When you look at a phone, whether you are holding it in front of you or down by your waist, your head tilts downward. We already established what that does to the neck. The load on your cervical spine muscles increases 3 to 5 times. Your shoulders round forward, your chest compresses, breathing becomes shallow, Everything we discussed about bad walking posture happens, but now it is actively reinforced and made worse because the phone angles your head lower than ordinary slouching ever would. Now, consider balance. After 50, the vestibular system, which is your inner ear's balance and orientation system, begins to operate with slightly less precision. Proprioception, your body's sense of where it is in space, also begins to fade. This is a normal, gradual part of aging. What it means is that your brain increasingly relies on what your eyes see to maintain balance while you walk. When your eyes are on a screen instead of the path ahead, your brain is deprived of its most critical real time source of spatial information. You stop seeing uneven pavement, curbs, steps, a wet patch, a sudden drop in grade. A fall after 50 is not just getting up, brushing yourself off, and moving on. It frequently means a fractured wrist, fractured ribs, or most seriously, a hip fracture. A hip fracture in someone over 60 means surgery, extended immobilization, and a lengthy rehabilitation that changes a person's life. The prevention is as simple as it gets. Put the phone in your pocket. And one final point on this: walking is not only physical exercise, it is neurological exercise. When you walk while paying attention to the path, the sensations in your body, your breathing, your surroundings, you are actively training attention, coordination, and spatial awareness. That is documented brain benefit. When you watch a screen, that benefit disappears. Your legs are moving, but your brain is occupied elsewhere. Let a walk be a walk. Mistake number 7, you ignore recovery after walking. Nobody discusses this, not in a clinic, not in most health programs. The general assumption is that walking is light activity, so no recovery is needed. That assumption is wrong. Start with water. Muscle tissue is 70 to 75% water. Every chemical process in muscle contraction, relaxation, repair after exercise happens in a water-based environment. Even mild dehydration, meaning just a 1 to 2% reduction in your body's fluid stores, measurably reduces muscle elasticity, slows repair, and increases the risk of cramping. After every walk, drink a glass of water. That is not a sports drink commercial. That is basic physiology. Now, about stretching. During walking, your muscles work in a shortening mode. They contract repeatedly. Without stretching afterward, they remain slightly shortened after you stop. Over weeks and months, this accumulates. Muscles become tight and rigid. The range of motion in your joints decreases. A persistent feeling of stiffness develops, especially in the calves, the back of the thighs, and the lower back. 5 minutes of gentle stretching after every walk prevents this entirely. 5 minutes. And about rest days. Many people reason that if walking is beneficial, more walking is always better. That is not how the body works. Your body does not adapt during exercise. It adapts during recovery. That is when muscle fibers reinforce themselves, when joints remodel in response to the load you placed on them, when the cardiovascular system restructures to handle the new demands you made. If you never give your body recovery time, adaptation does not occur. 1 to 2 rest days per week is not laziness. It is the correct protocol. Think of your walking not as an isolated exercise, but as a complete system. Movement, hydration, stretching, rest. Only as a complete system does it produce durable, long-term results. Here is something I want you to hear clearly before we close. All 7 of these mistakes carry a different weight depending on your age. The damage caused by poor posture, worn out shoes, and skipped recovery is 2 to 3 times more serious after 50 than it was at 30, because the resilience of your joints, your blood vessels, and your muscle tissue decreases over time. The same mistake your body forgave silently at 30 will produce real, noticeable symptoms at 55 or 65. That is not pessimism, that is anatomy. Let me tell you about someone I will call Robert 7-1 from Denver. He came to me convinced his knees were simply Worn out from decades of activity, he had accepted the pain as permanent. When we sat down and went through his actual walking habits, every single one of these 7 mistakes was present. Wrong shoes, more than 2 years old. One long walk on weekends only. Phone in hand the entire time. No warm up, no stretching, arms pinned to his sides, posture hunched forward. We rebuilt his routine step by step over 6 weeks. No injections, no surgery, no new prescriptions. At his next visit, he told me the knee pain had dropped by more than half and that he was walking 5 days a week without dreading it. 7 mistakes, 6 weeks, real measurable change. So here is exactly what I want you to do after this video. First, the slow start rule. The first 3 to 5 minutes of every walk, slow pace only without exception, it costs you 0 extra time. You are simply starting slower. Second, check your posture right now. Stand up, lengthen your spine gently upward, release your shoulders back and down, bring your eyes forward to the horizon, memorize that feeling, reproduce it every time you step out the door. Third, pick up your walking shoes and look at the soles. If they are unevenly worn, or if you have been walking in them for more than a year, it is time to replace them. This is one of the simplest investments you can make in your joint health. Fourth, stop the one long walk a week habit. 20 to 30 minutes, 5 to 6 days a week is the target. If that feels like too much right now, start with 3 days and add 1 day every 2 weeks. Fifth, let your arms move. Bend your elbows, relax your shoulders, and let them swing naturally in rhythm with your legs. Sixth, phone goes in your pocket for the entire walk. If you want audio, use earbuds. Keep the screen out of your hands. Seventh, after every walk, a glass of water and 5 minutes of gentle stretching. That is what stands between you and chronic stiffness. Walking is one of the most accessible, effective, and safe tools you have for maintaining your health after 50. You do not need a gym. You do not need expensive equipment. You need the right habits. And small changes in how you walk produce real lasting results for your heart, your joints, your brain, and your independence. This is what I do this for. Not to sell you something, not to scare you, to give you the information that the system does not have time to give you in a 1-2 minute appointment. Drop your age in the comments and tell me which of these 7 mistakes you recognize in yourself. I read every single one. And remember, everything in this video is educational information to help you ask better questions and make more informed choices. It is not a substitute for advice from your own doctor who knows your full history and your specific situation. Never stop a medication on your own. Bring it to your doctor. I made a video that explains exactly how what you eat after 60 changes the inflammation inside your joints, your blood vessels, and your brain, and which specific foods your body processes completely differently after that age. I will put it right here on the screen. Go watch that one next. I am Dr. William. I will see you there.